You are watching the DocTalk show.
So, welcome back to the DocTalk show. We are discussing long-term family planning methods. Just before we went for the break, we were in the discussion of intrauterine devices. These are methods that are available for women. They insert a small plastic T-shaped device into the woman's uterus, and that causes the effect of preventing pregnancies. I'll start with Dr. Chemonges. Are there any advantages the device brings?
It does not change so much the body functioning of a woman. So particularly the plain copper IUD, it just works as a roadblock. It does not contain a drug. Other methods like the implants may cause weight gain or weight loss. Okay. Yeah. Then also, an IUD can be used as an emergency form of contraception.
As an emergency. What does that mean, emergency?
So emergency means that you have had sexual intercourse, but you are afraid that you may get pregnant because you are probably in your fertile days, yet you don't want that pregnancy. So it can be used as a salvage or as a way of preventing pregnancy after already having intercourse.
There is immediate action, okay, protection. Once it has been inserted, there is no need for the mother to wait for a given period of time for it to be effective. So immediately it is inserted, it starts working.
I think that's a very big advantage.
Yes, yes.
That's why it can be used as the emergency contraception,
yes,
because it works immediately. You put it day one and it will start working on day one.
So there is no need for dual protection and what. Once someone has inserted it, you're good to go.
Okay.
Yes,
it's because some of the other drugs, the other methods, they require a time period to wait for the effect of the drug to set in.
So the other thing is it's very user-friendly, and there is no risk of, say, uterine cancers or infections. There is actually no other risk.
There's no risk of it. Okay, so it is very safe.
Exactly, yeah, very safe. Okay. And then the other thing is, of course, once it has been inserted, there's a part that a woman is advised can keep checking, okay, and it's a presence, okay. So there's a string, okay, like periodically, okay, we tell the mother to have a feel of the string, and we'll be able to know that it's available.
That it's still in the correct position.
Yes, that after insertion, some women may experience prolonged menstrual bleeding. Yeah, some women may also experience more painful periods.
Okay, is that something to worry about?
Yeah, this is a common occurrence, especially in the first 6 months of insertion, the first few months. But eventually they stabilize, of course, like anything foreign, okay, but eventually they stabilize. And
they may feel some low abdominal pain, but that one usually is transient. It goes away after, on its own, or after taking a painkiller. Now, if the menstrual bleeding is very heavy, then she may have to see a doctor, because there is medicine which can be given to reduce on the bleeding.
Unlike the condoms, it does not protect against STDs.
Yeah, definitely. So,
that's one let down with it, but either way, it still achieves the goal of preventing the pregnancy.
Definitely.
Okay.
Another side effect with the hormonal type of IUD is some women may not see their periods.
Okay.
It's particularly with the hormonal type, because of the hormone,
because of the
drug which is coated.
Okay.
Yeah, it may
so
cause
it may either cause heavy periods or light periods or
no bleeding.
So these are just some side effects.
Yeah, some side effects.
And these are
the device.
They don't cut across all. They may happen to one woman. They may not happen to the other. Okay, yeah. So it is it's at personal level. So it may happen, it may not. But when they happen, there are remedies for this effect.
Okay.
Some people out there say when it is inserted in the uterus, it can disappear, okay? move to the intestines and so forth. Some people say it can cause cancer, but actually there is nothing related to that, because it's a particular type of method which is inserted by an expert, okay, someone who is familiar with it, and before it is inserted, someone is screened for any of these risks, that is including cancer, because it passes through the opening of the uterus, what we call the cervix. Yeah.
So it will not cause cancer.
Yeah, it will not cause
cancer. It will
cancer.
not cause infection.
Yeah, it will not cause infection like per se.
And it will not get lost inside the woman's body.
It will not get lost.
It will just sit in the
It will
uterus
just
and
be
prevent
there.
the pregnancies.
Yeah, of course, sometimes the string, like I said, can get detached, it can fall off, okay? But this doesn't mean that the method has moved away. The method, the other T, remains intact, and it doesn't cause any worries for the mother to say maybe it has moved away.
It is important for a woman to, in case the strings detach. So what a user of an IUD should do is every month at the end of her menstrual bleeding, she should look at the pad, because rarely the strings may fall off with the menstrual blood. Rarely. Yes, even the IUD rarely may be expelled with menstrual blood. Yes. So it's in case she sees the strings on her pad or on her underwear, she has to go and see a doctor to have it examined. Sometimes the IUD may have got displaced or might be in the process of being expelled. So it's important for a woman to watch out.
Okay, to be careful, to check for its position.
To check for.
Okay, so in the final part of the show, we are going to talk about the permanent methods.
Yes.
Which are irreversible.
Yes, definitely.
And there are methods available for men and for women.
The women, yes.
You are watching the DocTalk Show.